Tonight for allegedly reusing syringes and vials of medication, putting hundreds of patients at risk for HIV, hepatitis A and B. KXLY4's Annie Bishop is working for you now, and she just spoke with the health district about what patients need to know. Annie?
Scary stuff indeed. Well, the Spokane Health District says the risk of getting HIV, hepatitis A and B is low. But even so, they are taking this very seriously and now urging patients to get tested. The Department of Health says staff at the Spokane Aesthetic Plastic Surgical Center at 801 East 5th on the lower South Hill reused syringes multiple times and vials of medication that were meant for single use. Those practices can expose patients to infections and illnesses. The Department of Health says it discovered the violations during an inspection in April, and the practices have since stopped. But according to investigators, at least 415 patients may have been put at risk over a 4-year period between 2006 and April of 2013. Mark Springer, an epidemiologist with the Spokane Department of Health, says patients need to be their own advocates and speak up when something just doesn't seem right.
Be an observant patient. You know, when you're at a facility, whether you're a doctor's office or a hospital or a surgical center, you know, if you have questions or something looks a little bit funny, ask questions.
Springer says if you were a patient of the surgical center, you need to go to your doctor and be tested. Usually you can get results in a few days and know either way. It's possible, though, an infected person can spread HIV, hepatitis A and B to others through contact with blood or body fluids. Now, infection cannot be spread by sharing food, kissing, or shaking hands. The surgery center is still open, and the Department of Health says it's developed a plan to prevent it from happening again, those alleged violations. The center did not return our call as of news time. Reporting live tonight, Annie Bishop, KXLY4.